There is good evidence for a strong correlation between testosterone levels and cognitive performance, such as spatial abilities or mathematical reasoning. Higher bioavailable and free testosterone concentrations have been associated with better performance in specific aspects of memory and cognitive function, with optimal processing capacity found in men ranging from 35 to 90 years of age. Subclinical androgen deficiency is also hypothesized to enhance the expression of Alzheimer's disease, or AD, related peptides in vivo. Decreases in bioavailable testosterone have been shown to predict decline in visual and verbal memory. Men with a higher ratio of total testosterone to sex hormone binding globulin, or SHBG, predict a reduced incidence of Alzheimer's disease, and patients already suffering from Alzheimer's disease were shown to have a lower ratio of total testosterone to SHBG compared with age-matched controls. In the Baltimore Longitudinal Study of Aging, a prospective longitudinal study risk for Alzheimer's disease was reduced by 26% for each 10-unit nmol over nmol increase in free testosterone at 2, 5, and 10 years prior to AD diagnosis. Altered testosterone levels in Alzheimer's disease may actually precede rather than follow diagnosis. In men undergoing hormonal therapy for prostate cancer, suppression of endogenous testosterone synthesis and blockade of the androgen receptor resulted in a beneficial effect on verbal memory, but an adverse effect on spatial ability and visuomotor slowing and slowed reaction times in several attentional domains. Plasma amyloid levels increased as testosterone levels decreased. Discontinuation of treatment resulted in improved memory but not visuospatial abilities. One of the possible protective mechanisms of action of testosterone would be through its conversion to estradiol E2, the most potent estrogen. Both serum estradiol E2 and testosterone levels were lower in men with Alzheimer's disease compared to age-matched controls. Estradiol E2 could exert protective effects on the brain structures in aging patients. Trials of testosterone therapy in men to evaluate its effects on measures of cognitive function and memory to date were all relatively small and of relatively short duration, and have shown mixed results. Small-scale testosterone intervention trials in elderly men suggest that some cognitive deficits may be reversed, at least in part, by short-term testosterone supplementation, although similar practices lead to increased cardiovascular risks. Androgen supplementation in elderly hypogonadal men improves spatial cognition and verbal fluency, while in elderly men without dementia it may reduce working memory errors. In addition, transdermal testosterone, or DHT, treatment in men aged 34 to 70 years improved verbal memory and spatial memory respectively, and intramuscular testosterone improved verbal and spatial memory and constructional abilities in non-hypogonadal men with mild cognitive impairment and Alzheimer's disease. In one study of healthy men aged 50 to 90 years, intramuscular testosterone alone or in combination with anastrozole improved spatial memory, whereas verbal memory only improved in testosterone-treated men with the absence of anastrozole, raising the possibility that part of the effect of exogenous testosterone is mediated by its aromatization to estradiol. Thank you for watching this video. Please be sure to check out the description for any additional information.